Hello everyone. Welcome to this webinar by Quizwings on preparation for the final year MBBS examinations. I am Disha Agrawal. I am an intern at Maulana Azad Medical College. We have with us Dr. Jay. He is an intern at St. GS Medical College, and today he will be covering surgery. We have Dr. Hari. He is a medical intern at JIPMER, and he will be covering medicine for us today. Then we have Dr. Sudhanshu. He is an intern at Motilal Nehru Medical College, Prayagraj, and he will be covering pediatrics for us. And later we will have Dr. Sonali Mishra from Lady Harding Medical College, and she will be covering obstetrics and gynecology. So I think we will start with the webinar now, and over to Jay to cover surgery for us.
Thank you, Disha. Good evening, everyone. I am Jay, and I'll be talking about surgery. Is it visible?
Yes, we can see your screen.
Okay. So I'll be talking about the surgery practicals first. So why practicals first? Because this is the area where examiners can fail you. No one gets failed in theory. Because if you have studied even 1.5 month surgery theory, you'll pass. But in practicals, it's all depends on what case you get, who is your examiner, and many other stuff. So let's see the marks distribution. This is of my university, and most university have a similar distribution. So there is one long case around for 60 marks. There is a short case for 30 marks, which makes about the 50% of the marks. Then ortho is also on the same day as surgery, which is for 30 marks, a short case and a clinical sign demo. And then you have your OSCE. So OSCE mein you can score marks because OSCE mein you'll get instruments which you'll know prior. There'll be X-rays, simple X-rays, pneumoperitoneum, pneumonia, a drain tube, simple X-rays. And OSCE also like many college have their PDF. They ask from that only. Even my college has one. So these are the scoring part. So if someday your cases don't go well, so you shouldn't be disheartened because you can still score marks in these areas. But our aim should be to master the cases because in this 1 year, the skill which you want to learn is the history taking and the examination in surgery. The thing with surgery is it is very logical. You don't have to like memorize much. And this is also a drawback because your examiners will remember everything because it is very logical, so they won't forget. It's not like some criteria or stuff. So they can catch you easily. So these are the major cases which come. So in long cases, you have obstructive jaundice, portal hypertension, lump in abdo, peripheral vein disease, varicose veins, and breast lump, thyroid swelling, and hernia. So these will be your long cases, which will come for 60 marks, and the short cases, which I have listed, the inguinal hernia, hydrocele, the amputation stoma, these all the swellings are in the short cases. So now, whenever you go to wards, you have to see these cases. You know, you should have a visual memory. There are many students who don't go ward for a year and then suddenly they appear in the exam and everything like they've just seen in the books. It is like what you read and what is in real is very different. So you should always visit wards and focus on seeing these cases especially because these are the cases which will be there in exam. So before you go to wards, I would like you to have a prior knowledge because your eyes will see what your mind knows. So you should always watch some videos like Ghanshyam Vaidya sir, like he's a surgery teacher and he has uploaded all the cases on YouTube for free and he has examined each and every case. He has given you the negative history, the associated complaints, and it is one of the best sources you can see. And it is the best thing is it is free and everyone can see. And this is this is of Nashta, sir. So Dr. Amrit Nashta has done MS from my college only from KEM, and he's a bariatric surgeon, a renowned surgeon, and he teaches in cerebellum as well. He also has a very good approach of teaching surgery. Like I studied from him. He takes some live classes also. Like he will be starting in Jan or something. So you can see his classes as well, and he gives you the logical approach which you want. Like when you study from Marrow, no disrespect to Rohan sir, is a very good teacher, but their things are taught bit theoretically. When Nashta sir teaches, you will understand the gist, you will understand the rationale behind it, and you can surely watch his. Some videos are free on YouTube because initially he used to teach in an academy, so those videos are free, and you can watch and you'll yourself fall in love with his teaching and surgery. For instrument, you can see White Army as well, and this sir has also taught instruments very well. So these are the things which you have to do in surgery. These cases, the long and short cases, you have to master. How you will master? You have to watch videos of Ghanshyam sir. Um, you can take Nashta sir's live classes and also read books. There are two books which I would recommend. Um, Das is bit extensive, but it has written things very beautifully, and you can read from them. And there is a book called as Pratik Patil, which was made by our seniors when they were interns, and it has also a very crisp history taking. You can read that book as well. So this is for surgery ka practicals. So go to watch these cases, watch watch the videos of Ghanshyam sir and Amrit Nashta sir, and you can use Pratik Patil as your main source for taking history, and things will be sorted. It is surgery is very easy, very rational, and if you understand once, you will not forget. So now about surgery ka theory. Um, Many people say that you should not read standard books. It is very vast. But talking about Bailey, Bailey is one of the most crisp book. They have written everything in very short and very, the best way possible is written in the Bailey. So you should definitely read Bailey. So what you should read in Bailey? Like Bailey is an extensive book, so you should not read everything. I have highlighted the topics which you should read. Like from the part one, the shock and the wound healing, from the perioperative, the nutrition wala part. So the burns, these you can oral cavity and salivary gland you can read if you have time. Otherwise, it's all right. But the three units which you should definitely read are the breast and the endocrine unit, the abdominal unit, and the genitourinary unit. So these are the main chunk. Like these are the 70%, the breast, the abdomen and the genital hernia. It forms the 70% of surgery, and you should read because Bailey has written it very beautifully. So once you uh, once you go to watch and see the cases and come back and read Bailey, it will be more than enough. But still, if you are not able to understand, you can follow platforms. So you can follow Cerebellum Prep or Marrow. I would recommend Cerebellum because Amrit Nashta sir is on Cerebellum and his way of teaching is one of the best and you can align it with Bailey and it will be all sorted. Even Rohan sir teaches well and even Prep has a very good teacher. You can follow whichever you like, but if you'll ask me, I would suggest Cerebell. Okay, so that's all from my side.
Thanks, Jay, for covering surgery so well. If I could just add a few pointers, to add to whatever Jay said. Sometimes, when we are posted in our own wards, there are no cases in our own wards. But always make it a point to, roam around the hospital and still look for the case. For example, in my surgery wards, we barely ever got any thyroid cases. We mostly saw them in the OPDs. But if you were to go to ENT, you would find a lot of thyroid cases. Same for oral cavity malignancies, you would rarely find one in your surgery ward, but you will find so many of them in the ENT OPDs and the ENT wards. So, don't give up if you can't find a case. Just, keep looking for it and keep looking at different wards. Don't just restrict yourself to the ward in which you are posted. Also, whatever you learn in the ward, it is always a good idea to compile all of that into one separate notebook, because when you're studying for your practicals, it is very helpful. All the pointers that your residents show you, whatever you've learned from videos, whatever you saw yourself while taking a case, just have a separate postings notebook, because I made one and it was very, very helpful. Okay, we will take all questions at the end. So let's move on to medicine, and we have Dr. Hari covering medicine for us.
Hi everyone, myself Hari Prasad. Now I'm gonna talk about how to prepare for medicine. Let me share my slide. Hello. Is it visible? Disha?
Yes. Hello.
Is it visible, Disha?
Yeah, it is visible. I'm sorry. I think I have bad network. You are visible.
Okay, fine. Okay. Now I'm gonna talk about medicine as a whole. It's not about for just for exam sake. This is the most beautiful subject ever, which you will come across in the whole MBBS. So it's not about the exam mark and passing the exam. So basically, the whole idea essence should be acquiring the knowledge. So you have 3 to 4 months you are having. So try to acquire the knowledge first. Knowledge is power. Once you acquire the knowledge, then the exam will be cakewalk only. The medicine is humongous. You can't conquer medicine in 3 to 4 days or 10 days. So the only technique which I use is divide and conquer. You should divide the subject into lot of weeks and study and specialize the subject. So I can divide systems. So cardiology, hematology, or endocrine, rheumatology, it will have things from derm, environmental toxicology, and ethics. Is it there in other colleges also, right?
Voice is
You will
not
get questions from
clear.
derm also, right?
Sorry to interrupt. People are saying
My
that yeah, it's not clear, and the screen is also not clear. Maybe we could zoom in.
okay, let me zoom in. Is it visible now?
Looks better to me. Can people
Yes, it's visible.
confirm in the chat also?
Yes.
Yeah, so what I told is medicine is a humongous subject. So we need to divide it into various bits of pieces and master those topics. That's the only way is possible to study medicine and understand its essence. So medicine can be separated into 8 systems plus one infectious disease and allied subjects like dermatology, psychology, and toxicology and ethics. Questions will be from in these topics also. Am I audible, right?
Yes, I can hear you, but others seem to be having some issues. Is there a better network that you can connect to?
Yeah, I will. Let me try.
Just try once.
Till
If it
then,
doesn't work, then we'll see.
till then, Sudhanshu can continue, and then Hari, you can do it
Yeah,
later.
sure. So that
Yeah,
you can continue.
Yeah, we could do that.
yeah, sure.
Yeah.
Okay. So we'll have Sudhanshu covering pediatrics right now, and we will get back to Hari once he has a better connection. Over to you, Sudhanshu.
Yeah. Um, Am I audible?
Yes.
My screen. um,
Yes, it's visible. Yep, we can see the screen. We're good to go.
Okay. So talking about pediatrics, first of all, pediatrics is not just only it's also about the children because you talk to children and that definitely sparks an inner curiosity because yeah they are difficult to handle with. So for talking about pediatrics, yes, it's a short subject, and we have one main source for it, and that is Essential Pediatrics by OP Guide. That is the gold standard. So talking about the coaching notes, yeah, like it gives you an important gist for the PG exams, but it often skips many university questions. Like I myself had prepared from Marrow. Um, so, like few of the topics, some question was there on autism or some national programs. They are quite often missing from the notes. So you need to study Guy if you want to do well in your uh, professional examinations. Even many of the questions of NEET, PG, and INI set they are directly from the lines of the Guy. And even this exam of UPSC CMS, it also has some direct questions from the Guy. So, yeah, and there are in prep by Meenakshi Bothra, there are some good mnemonics. So, I would really recommend you to at least, if not all, reading the first chapter is must from the guy because they will develop you a foundational concept. I will tell you in a while why it is so. So, if I say many questions, students were asking about the timeline, like in what timeline. So, according to me, if you say it would be for final year, it would be 1 to 2 months, and if you say in 1 month, you can divide it into four. So first, you can cover growth, development, nutrition, and their disorders. Second is immunization and neonatal care, and then you can study the neonatal disorders. Thirdly, you can go on with the fluids and electrolytes that is often missed, and then the systemic peds. And lastly, whatever is remaining, you can study. You can see the past 10 years of your university, and whatever the topics are there, you can do them. So general peds, neonatology, and systemic pediatrics. So for general peds, yeah, you have to first have a concept of the growth, then their disorders, then the development and their disorders, and also behavioral disorders. I have not written it here, but you have to cover that. And peds is also somewhat integrated. So if you have previously notes, just integrate with them. Like if for PSM and microbe, you can easily cover if you have notes of that immunization, like RBSK, JSSY, infectious diseases. Infectious diseases, I feel it is better given in Park. So yeah. So please keep taking immunization history whenever you are taking case in the wards, and also create some mnemonics, or maybe just you can do that thing like active recall kind of thing using your workbook. Talking about the genetic disorders, Down's, Turner's, Klinefelter, these are my university trends. I have filtered it out of those. You can modify it according to your own needs, but I feel these are something you must definitely have. Then Edward Patau, then Paderwilli, Engelman, and others. So my advice is these are some of the topics which are often like you forget it. So you can create mnemonics or just create a photo like of the child given it, and just you can do that, put a hand on that child and just try to recall whatever the features are there, because this is something we often forget. Like we remember the mnemonic, but we don't not able to recall inside it. So even sometimes to remember a mnemonic, you require a mnemonic. So revisit the cases as many times. Always ask the nutritional history. And for the infectious diseases, measles, rubella, scarlet fever, you must cover. Then you can cover the other all the day, first day, second day, other day diseases. For neonatology, I would say normal newborn care, that is the important, and everyone, like even you have neonatology practicals, you're done with the NRP, you practice it on a dummy. So normal newborn care is really expected from you. And yeah, you can, whenever you get time, you can quiz the things with your friends and practice it. You can then study about the neonatal disorders. Sepsis, jaundice are important. Respiratory tristis is also important. HIE, neonatal scissors. So these you can go on. For the systemic, like you can divide into systems. Like for gastro, diarrhea is very important because in IMNCI it is also asked. It is there in the practical also. Yeah, for systemic beats, my suggestion is like if you have covered well in the medicine and surgery, you can use those notes only. Like for the surgical disorders like bacterial or tracheoesophageal fistula, for liver disorders, medicine is, I think it is covered beautifully in medicine. So yeah, definitely. And for hematology, if you have done it well in patho and medicine, you don't need to do much. It is given well there. So if you have notes of that, you can save your time here. For respiratory, I feel these are the really important topics, and you must definitely see them: pneumonia, pleural effusion, then bronchiolitis, asthma, and then others. CVS was a part which was really difficult for me because I kept forgetting it multiple times. I read it. Maybe if some of the speakers here, if they have it, they can tell. But one thing is that I would like to tell, like you can make your own notes from the lecture. You can write in your own words and keep revisiting it. For the genitourinary, these are the really important topics: nephrotic, nephritic, AKI, CKD, and then you can cover the other topics. Because these are like are repeated every year, like especially in our university, so it is repeated every year. Talking about endocrine, congenital hypothyroidism, pubertal disorders, growth hormone disorders, these are very important. CNS is very important for the practical as well because you definitely get case of either CNS infections, even of GBS, that is there, hydrocephalus, scissor. In neuromuscular, also it is, these three are at least you should have a concept with myasthenia gravis, Duchenne muscular dystrophy, spinal muscular atrophy. And for the hemato-oncology also, I think path in medicine, you can integrate with leukemia, lymphoma. They are covered well there. So no need to cover them separately. For rheumat, I think JIA is one of the important topics I feel here in the PEDS. So for Guy, I would suggest you to don't miss the tables, graph, and flowcharts of Guy. If you really want, you can take the SS and make the PDF of whatever you feel and create a short copy for the volatile topics. Or if you don't want to don't have time for that, you can just in your lecture notes only in the side, you can write 3 important points and you can revise them in the last. It helps a lot. And for the MCQs, you can do it from any of the review books or the apps that you are using. Our university, it had about uh, 20 questions, 20 questions in MCQs. And do solve the custom modules after you have completed certain section, mix and match the concepts. That way, you will be really tested because after learning, we all can get full out of full. But after a certain time, if you're revising it, that's when the real test comes. And many times like there are many clinical features, so we have difficulty learning, like neonatal sepsis is there. So just classify like respiratory can be affected, GI can be affected, like nausea, vomiting. In respiratory, some pneumonia can develop. Like this way, if you do it, it's easier to recall in the exam. And for writing theory paper, I guess we all know this, but again to reiterate it, yeah, definitely need handwriting. You need to have the flow charts, tables. You need to write in, highlight the important points, divide into headings, subheadings. For example, neonatal sepsis, they are just classify early onset, late onset, and give classification or diagrams because it really creates an impact. So yeah, I already told if you are in final year, you can complete it in 1 to 2 months. And if you are third year, you can take your time, just develop in 4 to 5 months as per. And yeah, 10-year topics, important topics, get a printout of it. Completing them is must. But yeah, your target should not be just that. You should target to complete all the competencies that are there. So that was per se theory. And talking about the practical, yeah, Piyush Gupta is the gold standard. Like 95% of the students out there in my college also, they are reading Piyush Gupta only. But though I had bought Scott Pediatrics, I have heard from JR. So that was also a good book because it was case based. But yeah, Piyush Gupta is the gold standard. I also had seen it, so it is given beautifully there in Piyush Gupta. Like we had in if you are well with theory, practical it will not be that much difficult. You can definitely like first have the growth, development, nutrition thing, then immunization and neonatal things, and then all the systemic feeds, and then the others, whatever are remaining, like IM and CI. For the videos things, there is very one beautiful channel, Learning Pediatrics by Dr. Rekha Thadane ma'am. So she has like all the X-rays, NRP is also given beautifully. The immunization thing is also given there, and systemic feeds, yeah, that. And I like for serious practical, I watched her videos only. So like it was there. Like if you watch it here also, it will be sufficient. So it is given very beautifully. White Army, again, you can refer to case-based cases that are there in the White Army. They're also equally good. So basically in practicals, we have long case, generally one or two short cases. We had one short case and table viva. So long case, prepare the, like it can vary a little bit. See, this is not that you have to follow it blindly. Adjust it according to your own needs. Have it like, so see your own university, what does it offer and what does it require. So prepare nephrotic syndrome, pneumonia, pleural effusion, liver failure, GVS, because these are often repeated years after years in the practical. And you have to take detailed history taking, examination, proper anthropometry, every proper heading history examination, and it's a bedside viva. One thing that I'd like to tell you, that your approach is more important rather than the diagnosis. Whatever findings you are, just don't try to modify it just for diagnosis per se. Whatever is your finding, just try to explain it. And it's not important that you arrive. Like first identify which system is there, whether it is respiratory or gastro. Like if it is respiratory, like it's infectious, non-infectious, or it's restrictive, obstructive, and then just try to have the differentials in your mind. Short case mainly have targeted history and examination. Anthropometry is maybe skipped. In our college, in short cases, they kept it newborn. So like they asked about neonatal reflexes, or uh, they asked about neonatal jaundice or something. So it's a targeted history and examination, or about the milestones things. So yeah, that you have to prepare. Milestones is really a daunting task. That was for me also. I just stick it in my wall. Still, I have forgotten many of the. So create your own mnemonics and revisit as many of times, or maybe make a PDF in your phone. So NRP and instruments are there. You have to read about all the instruments out there. Ambo bag, MR SOPA mnemonic is there, and X-rays are well covered in Rekha's ma'am videos also. So you will really have a great tool, or whatever things that are there in your college. Just try to make a PDF, write it with your own pen, edit it with, or get a printout of it. That will help you in the last time, because you don't want to do these things at the last times. Similarly, for the drugs which are kept there, just make a list of it, immunization, calorific value, and OSCE is also there many times. Like we have to counsel the breastfeeding or danger signs of newborn. So it's easy. So yeah, present as many cases as you can. That will give you the confidence. Like I had personally presented two cases, but I feel people who presented more cases were more confident in the examination. And even if you're not presenting it to the professor, just present it to the JR per se, and don't hesitate to ask to teach the examination if you're not sure. And maybe you can have some practice session with your friends also. One can act as an examiner, the other examinee, and it will stimulate that exam environment. So few questions were there at the last. So some is like understand like why you need to learn pediatrics. Learning pediatrics, it really gives hopes to the parents as well. Even if you don't want to become a pediatrician, there are lots of children out there nearby. They will be coming. So if uh, you stay curious, and definitely my friend also said, like if you start loving whatever, then the path really becomes easier to you. So whatever you're doing, just try to reason it, try to love it, and you will definitely fall in love with pediatrics. So active recall is one thing. Like if you're giving 2 hours to studying, watching lectures, or reading some notes, just sit 15 to 20 minutes close your eyes, recall thing, or just write it on a piece of paper. It has really helped me in many of the topics. And पढ़ाई में तो नहीं शर्माना है कभी. Like if अगर you are thinking of a certain answer with your friend, just try. गलत ही होगा, एग्जाम में गलत नहीं होगा. So never ever shy in when it comes to learning. So have good friends who encourage each other, and they don't judge you for mistakes. Rather, they tell you how it's done. Thank you.
Thanks, Sudhanshu. So for pediatrics, I think Sudhanshu has summed it up really well. There is this one book on practical pediatrics called Piyush Gupta that we follow at least in the Delhi University, and that is really good. Like you can learn how to examine patients, and also the first few chapters have things like nutrition, growth and development, how to assess those, how to assess feeding history, all those things. You know, the basic pediatric stuff that you absolutely need to know. So you may want to check that book out. Also in pediatrics, I feel if you get the basics right, like nutrition, immunization, growth and development, neonatology is very important, and Ghai has given neonatology beautifully. Like just read the first 10 chapters, as Sudhanshu said, very diligently, and that is like half the syllabus. Even if you get the systemic examination wrong, nobody really minds, but you cannot muck up history taking and anthropometry. These are the absolute basics that you must know for your practicals to pass. Systemic, to it's okay. Matlab, if people are not very confident, but anthro will help you pass for sure. Okay. So, Hari, are you ready to present?
Yeah, I am ready. Am I audible now?
Yes, you're audible.
Yeah, since I am in village rural posting, I don't think my screen will be visible that good, so I will be communicating by voice itself. Is it okay for you? Is it okay for everyone?
Yeah, your voice is still breaking a little bit.
Hari, I guess you can switch off your video. Maybe that will have less of bandwidth. Maybe you can
Yeah,
switch
sure,
your
sure,
video
sure.
and just share the screen.
Yeah, yeah, I will definitely share the PDF. Okay, I will share it first. Okay, that's good. I will share the PDF now. Side by side, I will talk. Now am
Hari,
I
you're
audible,
not
right?
icon on my screen.
Huh?
Yes, you are.
Yes, it is now clear.
Yeah, okay, then fine. I will share it in the group. Disha will share it in via her screen. I will just
Yeah, yeah, I can do that. Just send it to me.
yeah, yeah. Hopefully everyone's hardest nightmare is medicine only, right? Medicine is the toughest, hardest, scariest subject in the final years. But I will tell the way how to handle that subject with with interesting manner, which you will enjoy studying medicine. Uh, 8 seconds. PDF is loading.
I guess meanwhile Sonali has
Mm.
also joined. Like meanwhile, if
Yeah,
Yeah, then
you
to
are not, Hari is not getting late. Maybe she can present.
yeah, it's ready. She
yeah,
can present definitely.
okay. I'll ask
Wait, I
her.
don't know why. If my voice is audible, I will later telling my voice itself. I will send the PDF later because it's also loading. I don't know what is the issue, right?
That is okay. I think it will be better if we have the PDF also. If
Yeah, yeah,
Sonali
I
is
can
not available,
understand.
we'll continue as it is. Else, she can present first.
Okay.
Sonali, can you hear me? And Hari, were you able to send me the PDF?
Yeah, I'm trying. Yeah.
What we can do is, if any of you have questions on peds and surgery, we can address those first while we wait for the PDF to arrive. Okay. Hari, I think you should
It's,
start.
I think I
So
will
now,
go with my voice. It's, I will.
ठीक है. Okay.
Studying only way is to divide and conquer the subjects. So as everyone divide the medicine into system wise. So we can divide medicine into cardiology, neurology, GI and hepatology, hematology, respiratory system, endocrine, rheumatology, and infectious disease. So in that itself, you should able to make many subtopics into cardiology. For example, you're studying cardiology. So you're setting some 3 days for cardiology means you shouldn't blindly study as important question MI, RHD like that and all don't study. So every topic is a patient only. So each topic you should know some 5 categories, 5 subheadings. So it will also help in exam also. So if example, I'm taking myocardial infarction. It's a very important question also. So how you should approach that topic is, first you should ask yourself what is the etiopathogenesis and risk factor for MI. So try to read. So in medicine, there is no proper source to study. You can read from anywhere which you liked. So you can read from marrow. Some people doesn't like marrow how the chart is. So you can read from cerebellum. You can read from dams. You can read from Bhatia, or you can read from any standard books also. The thing is, you should understand the concept behind the topic. So MI is a disease. So you should understand what is the etiopathogenesis and risk factor. At the end of the studying MI, you should be able to answer yourself, okay, this is the pathogenesis of MI, this is the risk factor for MI. Okay, then what is next? What is clinical feature? How MI patient will present to me? That you should be able to list out. It doesn't matter from where you are studying medicine, that doesn't even matter. So don't focus on source, just focus on the topic concept. For you can study from various sources. If some source, example medicine, if some cardiology is bad means you choose YouTube. It come searching MI explanation for MI. Like there are a lot of resources where you can understand, or you can ask your friends. In medicine in final year, the most important, like most good teacher are your friends only. You can ask them to teach. Can you teach the topic of forage? They will teach. That will stay long for you. So at the end of the topic, you should be able to tell what is the clinical feature of this disease. Next, okay, how will I investigate? How will I diagnose this disease? So you must know what are the investigation I should order. What is the diagnostic criteria? If MI means what is the diagnostic criteria? What should I do? I should take ECG. I should take clinical markers, biochemical markers, and I should take echo. This and all you should know about the disease. Then how will I manage the disease? What is the immediate management? What is the later management? And what will happen if I didn't manage? What is the complication? How should I manage the complication? These are the 6 topics in every topic which you choose in medicine. So, if example in cardiology, there are some 10 to 12 topics. I will tell. I will send the PDF. You just if you are reading cardiology for 3 days, just take okay MI. What is the MI finish MI with by these 6 questions. So you're able to answer these 6 questions. You can able to crack any exam, even if it is NEET, PG, INI, university exam, Viva, whatever the exam you can able to crack. You make your own notes. This will be the best method, and also you'll be able to treat patients very easily. So second up is clinical cardiology. In cardiology, everyone tends to miss this. This is the most important. Pulse, JVP, um, BP, sounds, odd sounds, murmur. This will come under clinical cardiology. You will tend to forget this topic and think, okay, it will be asked only in practical. It's not like that. It will be asked in Even in theory also, one mark in MCQs, this will be repeated multiple times. If you are strong in clinical cardiology, you can ace the practical exam also. Then the important topic in cardiology is valvular disease. In that MS, MR, AS, AR, you should be able to read, like from each topic, these 5 questions you should ask. Like this, there are 9 systems is there rated. So I have divided myself what are the important topics, what are the subtopics in that. You just print this form and tick, okay, I finished MI, I finished clinical cardiology, I finished valvular disease, I finished the RHDIE, I finished heart failure, I finished systemic hypertension, I finished pulmonary hypertension. So at the end of 1 week, you will be confident in cardiology. But after third week, you will forget, oh, RHD, what is the clinical picture? So then you revisit this subject. This is the way you can learn medicine. Like you can't mug it and vomit in the exam, because mug it and vomit in the subject will be happen only if the subject is short. Medicine is such a huge subject. You can't mug and vomit in the exam as like what we did in third year ENT after and all. 3 days before the exam, you just study everything and vomit it in the paper. That won't happen in medicine, because the expected question won't be there in your university exam, or question examiner, uh, external examiner won't ask those easy questions and all. So you should be able to be clinically strong enough to answer their questions. So if neurology means stroke is there, spinal cord disorder is there, inflammatory demyelination disorder or seen as like multiple sclerosis is there, and if see, this is approach. Neurology is all about approach. Headache means how you approach. Primary headache, secondary headache. Secondary headache means there is some trauma like that, hemorrhage. Primary headache means migraine, cluster headache, trigeminal neuralgia, Sun syndrome. So this is the way to study medicine. It may not be as effective as studying previous questions and getting mark. I am agree with that, but that doesn't matter. It will help in your initial exam, in your while you're treating patients. If you study like this, you will be a good clinician also, like memory and dementia, movement disorders, seizures. So in seizures and all, like there are multiple important questions are there. So try to finish each topic. Like this, if you finish all some 8 systems are there, if you finish all these 8 systems, you will get some confidence. Now with this, you need to see the real patients. So in exam, the easiest part to crack is theory part. Whatever you write, like with this 5 topics, etiopathogenesis. If someone asks about some cirrhosis, you can write etiopathogenesis by infection, metabolic disease, alcoholic disease, autoimmune disease, cancer. Like this, you can somehow manage. But practical is not like that. Practical is what you did from second year till now. How much patients you have interacted, how many patients you have taken history, how many patients you have examined. It's not about patients. See, in medicine, many people will tell, I didn't get to see more cases. How can I be confident? Our HOD will sir will tell, normal patients are the most important people. Like our friends are normal patients. So try to examine them. If you know what is normal, then you will definitely pick up what is abnormal. If you know how to examine the method of examination, then you will definitely pick up the abnormal things. You may not be know what is that. You may be hearing that first time, but you will definitely know this is something abnormal. This should not be there. See, this is what you want to know. In practical examination, there are 3 parts. First, history. You should there will be only 40 minutes. There won't be like patient will be telling typical history of MS, MR. No one will tell. They will tell my grandmother died. I got a day. Like they will divert it from anywhere. So you shouldn't be distracted from that. You should make a performer before itself. So so go and ask the chief complaint, they will tell pedal edema or breathlessness. Then breathlessness means only 2 causes, like majorly in examination, either it should be CVS or RS. Try to rule out with by some leading questions. Once you get to know it is CVS, so you should be already knowing the performer of CVS. Okay, what and all should I ask? What is the native history? No one will look what diagnosis you made. Oh, you made MS plus MR. That's nice. No one will look like that. How you took history, that only they will look. So you should try to ask the native history and the rationale behind the native history. In all medicine, history will save you. If you perform history well, you definitely pass. If you perform history in the examination well, distinction. If you perform history examination and post presentation viva good, you are the gold medalist. No one can do all three perfect, but you try to focus those skills. First skill to be learned is taking history. So make a performer. Performer can't be made in a single day. If you're second, if you're third year, finally, if you're seeing first case, you can't make a performer. Performer is like evolving thing. Every day, if you see a new patient, every day you attend a new clinical classes, the professors will ask like, why did you ask? Why you didn't ask that? Then it should be evolving. No, so don't follow some already pre-made performer. This won't help you. You try to make your own performer that will stay along with you, and it will be in your mind. You don't need to mug up before the exams and get an anxiety attack. In medicine, people will fail because of just anxiety, nothing else. They will know the answer, but in the anxiety, within 40 minutes, you can't present a long case before without the practice. So make sure performer is very well made just by practice only. Then what will ask? So you will present history. What you will tell patient present with NIA grade 2 breathlessness. They will ask define breathlessness. What is the grade of breathlessness? What are the cause of breathlessness? Then if you tell the hematemesis, they will ask what are the cause of hematemesis. Hemoptysis, what are the cause of hemoptysis? So whatever the history, whatever you utter, you should know about something about that. So I will tell, in practical, history is there. So learn performer and question related to each symptoms. Symptomatology. This you can learn very well in Insider's Guide. There's a book called Insider Guide. It will have very promising all questions, possible questions which a professor can ask. So Insider Guide, I will type in group also. Okay. Then okay, if you are master the history part and if you answer those questions, then you will be proceed to examination. In examination also, like this, you can follow pre-made performer, and this the most important is don't miss general examination. Don't fake general examination detail. Medicine in other surgery, ortho, OG and all, you can fake general examination details. Summa BP you can write, normal BP, whatever you can do. But in medicine, never ever fake any details. If you're not able to do, you can just tell, I'm not able to do because of this. They will understand that. So then methods of examination, spleen examination, liver examination, this and all you should learn from some standard books. There is a book called Federaman book which explains in a good manner. You can refer that. Or the most promising way of learning skills is what in your college they are practicing, because HODs are like their egoid. So they want you to follow in their what they teaching. So don't tell I read in Aris and I read in some other standard books. They will get irritated. So you just follow what in your college they are following, and get to know from SRs or junior residents, and follow those examination steps. External examiners will tell why you are doing like that. Then you can defend yourself. Sir, we are practiced like this only by your internal in our college, so they will accept that. Then next step is question related to the examination part. So if you tell splenomegaly is there, then they will ask what are the causes of splenomegaly, what are the methods of examination of splenomegaly, what is the examination in case of ascites, how will you examine the spleen? Like this only your viva will go. So if you are very strong in history and examination and theory behind that, no one can fail you. So diagnosis never gonna save you. If you fake if you bring the diagnosis correct, but your history examination is very illogical, then you will definitely fail, because they know you got the answers from some JRs or some friends. So they will definitely want you to make fail. Even if you stand innocent in them and tell whatever you know, you will get to pass. So be prepared for that. Then post-presentation waiver. After you present and tell your diagnosis, then they will ask, what are the other details for your case? Then you should tell why you become a basis for that, and what are the investigations you will order for this patient, and the reason behind it, and what is the management for this. So this much only they ask. So all there are only CVS, RS, GI and hepatology and hematology cases they will ask, like Hodgkin lymphoma, those things. So in CVS and all, uh, you will train to like, okay, MS means mid diastolic murmur. In my university, I got MS case. There was no MDM, but I identified MS because you can diagnose valvular disease with just pulse, BP, and palpation, JVP, and all. So try to focus on that. Don't focus on murmur. I didn't get that murmur. Or don't fake murmurs. Whatever you can tell, like, sir, I am hearing like some. Even this demonstrate, you don't fake murmurs. They will definitely they are better here. They know what level we are. So don't try to fake any details in your practical. The most common reason to fail in medicine is from practical only, and because of faking details. I have seen many people faking details and get failed in my internal examination and send-up examination because some people, some JR told this is a splenomegaly case. Okay, he didn't feel spleen, but he told some 5 centimeters splenomegaly is there. That HOD sir went and told, okay, you are a threat to society. I will fail you. He failed them. So don't fake details because of some friends. Whatever you feel, just you tell them. So this is basically practical part. You can definitely pass in practical if you've seen enough patients. So there are 3 to 4 months are there. Go to ward every evening. If you're not able to find patients with findings, it's fine. Just auscultate normal patients. Just examine the neurological reflexes. This in CNS, you must if you're not able to get reflex, that's completely fine. Many people won't get reflex, but you should demonstrate in a correct manner. So that and all you need to practice in medicine. Theory part is fine. Whatever I told, a theory part is mainly in exam before some 1 month of examination. Take your previous year question paper, whatever state you belongs to. Take the previous year questions. If cardiology means okay, MI is repeated 10 times, I will read all details about MI. Okay, valvular disease has some 20 times. I will read about that. RHD, IE. Okay, these are the most repeated questions. I will master those questions first. Then I will, okay, cardiomyopathy as the rarely. Pericardial disease, some constitutive pericarditis, they are asking more. Some signs are there that will be asked in 1 month. So read like that. Previous, you go to PUQ questions only at the last one. Don't jump now itself because you have enough 4 to 5 months are there. So I will send the PDF. You try to finish each subject. I will just read out that. It will be like reading the index only. But yeah, this is that. In cardiology, MA is there, clinical cardiology is there, valvular disease is there, RHD, infective endocarditis is there, heart failure, arrhythmia, systemic hypertension, pulmonary hypertension, pericardial disorders like tamponade, effusion, constatic pericarditis is there, cardiomyopathy, aortic disorders like dissection and aneurysm. Neurology, stroke case is the most important. Spinal cord disorder is there, paraplegia cases, inflammatory demyelinating disorder, CNS, multiple sclerosis is there. LMN approach in CNS approach is the most important. Siddhanshu also told in pediatrics also, approach is the most important they will expect. Able to if you are element in element means where an anterior console or if it is a peripheral neuropathy or it's a problem of neuromuscular junction or it's a problem of muscle. This thing what is the difference between these five? You in case of weakness you can't directly jump like this is stroke. Don't tell like that. Sir, this is acute event. So I can suspect two conditions. In acute events only vascular events are possible, which is stroke and are possible. So, Goulet syndrome, multiple sclerosis, and neuromyelitis optica. These are the possible. So you should defend. You should be able to defend yourself. This is the most skill and most rewarding. Also, if you have knowledge, you can easily defend any questions, and also HOD or prof will get happier if you understand and tell the answer. Then headache, memory and dementia, movement disorders like Parkinsonism is most important. Seizure and the status epilepticus is most important. CNS infection, meningitis. So don't tend to forget infection spotting medicine. Infections are most common questions which are repeated, like tuberculosis meningitis, bacterial meningitis, viral meningitis, fungal meningitis. Those things is common cases, so they will ask commonly. In GI hepatology, IBD, IBS, malabsorption. Hepatology means approach to hyperbilirubinemia, because you will get a DCLD case. They will go in all directions of hepatology. So you should be able to tell why it is not acute liver failure, why it is a chronic liver failure, what are the causes of chronic liver failure, what is the complication, portal hypertension, what is the feature of portal hypertension, how will you manage portal hypertension, what is the surgical management of portal hypertension, why it is not what like viral hepatitis means, how it will be present, why not metabolic liver disorders. See, everything you should be able to defend yourself. If you read the topics which I given with the 5 basic questions which I told: etiopathosis and risk factor, clinical features, investigation and diagnostic criteria, management and complication. You can ace your medicine examination and even in practice also. In hematology, approach to anemia, microcytic hypochromic anemia, SITA, iron deficiency anemia, sideroblastic anemia, thalassemia, and anemia of chronic disease. Megaloblastic anemia, what are the megaloblastic anemia is not equal to vitamin B12 deficiency. There are multiple causes of like uric aciduria and everything. Hemolytic anemia, approach to hemolytic anemia, pancytopenia, approach to pancytopenia, myelodysplastic neoplasm, myeloproliferative syndrome, acute leukemia, Hodgkin lymphoma, non-Hodgkin lymphoma. This will be overwhelming for you. But if you sit and study and see cases and revise, you will get to know, and it will take a lot of time to understand. You will tend to forget, but it's okay. At least you will see, okay, acute leukemia, it will present like infection. Like you can able to tell some 2 to 3 clinical picture on definite investigation, on definite management plan. It's not needed to tell all drugs used in Hodgkin lymphoma. No one will expect, no one will remember. At least, okay, it's CHOP regimen. I didn't forget the full name, but it's a CHOP regimen. They will get happier only. And disorders of platelet, disorders of coagulation, like this in RS, you should be able to read pulmonary function test, ARDS, respiratory failure. What are the types of respiratory failure? This may not be coming exam, or may not be dominating in the exam, but this is the most common cases you will see in practice also. So it will be good to know also. So sarcoidosis, pneumonia, aspergillosis, COPD, bronchial asthma, bronchiectasis, pleural effusion. So all topics I will send, you just read. In endocrinology, anti-respiratory disorders, acromegaly they will ask. Posterior pediatric, only 2 diseases which is most important: SIDH and diabetes insipidus. Sodium metabolism, hyponatremia, hypernatremia, hypokalemia, hyperkalemia, hypocalcemia, hypercalcemia. This dyselectrolemia, acid-base balance, and all you must be very well. At least those basic stuff you should know. This is the medicine. See, every topic you have already studied in pathology, microbiology, and pharmacology. What is different in medicine is some ECG, this electrolyte imbalance. These are the stuff which will be most fascinating in medicine. So try to. I don't recommend anyone, because I read from some from cerebellum that Dilip sir. Many people also like marrow. You can read from anyone, but at the end you should be able to list out all the causes of hyponatremia, approach to hyponatremia, management of hyponatremia. Those things you should know, able to know. Then diabetes mellitus, the most important. You will definitely get a question from diabetes mellitus either in theory or any part of the viva. Rheumatology, inflammatory arthritis, either some people tell arthritis, there is only 2 causes: inflammatory and osteoarthritis. Osteoarthritis won't be your case. So inflammatory arthritis means either it can be rheumatoid arthritis or seronegative spondyloarthritis. In seronegative spondyloarthritis, you will be mostly asked about spondyloarthritis only. In vasculitis, you should be able to list out the causes of vasculitis: SLE, Sjogren syndrome, scleroderma, like this. And nephrology, acute kidney injury, CKD, you must be thorough. Nephrotic nephritic syndrome. These 4 is enough. If you most keen in studying, you can study renal tubular disorders, Liddle syndrome, Gittleman syndrome. There are multiple syndromes. If you answer well, they will go to these questions and all. Acid-base balance is very must. So this is what I want to convey. Anyone having any doubt? I think I went so far.
Hari, I think we'll take doubts at the end.
Yeah.
Let's just have
Okay,
Sonali present, because I think she's in a hurry also. Sonali,
sure.
are you there?
Hello, am I audible?
Yes, and you can share your screen. The option should be available.
Okay. So I'll share my screen once I'm in the midway of my discussion. So I'll right away start then. Okay, so very good evening, everyone. So after these elaborate discussion about surgery, medicine, and peds, I'm here with Obs Gynae. So before I start, it's important for you to know that it is going to be one of the easiest subject in your final year if you have the right approach. So why? Because first of all, it's easy to understand, easy to retain, and easy to recall. And also, there are few questions that are repeated every year. And I think all the universities would agree with me that these are the same topics that repeated everywhere also. So right away, okay. So you all can keep your questions ready because I'll cater to it once I'm done with my discussion. Right? Okay. So Obs Gynae is divided into theory and practical. In theory, it's important to make your basics clear. For that, I'll recommend to stick to one platform, either DAMS, Prep Ladder, Marrow, anything. Get your basics clear. Do it in one stretch only. Don't complete it in like I'll do one topic today, 2 months के बाद second topic. No. Complete it in one stretch. It won't take you long. Get your basics clear, get your Obs Gynae together, and make a good platform to begin with. Right. Once you're done with your notes, revise it again and again, at least 3 to 4 times, so that it gets into your brain completely. You absorb it completely. Right. After that, I have some of the if you have some pen or paper beside you, you can write those chapters which I'll recommend, and my seniors also recommended me, and it helped also. So Datta is some, like, I am a book reader person, so I read a whole book, but it's not needed actually. So you can read some of the chapters which are actually very important, not only for theory but also for practicals. Okay, so first and second chapters are like, you can do it from anatomy if you are good at with, or you can read it, but I'll suggest ki anatomy se kar lo. And then most important chapters are 5th, 6th, 7th, 8th, 9th. Then 13th is actually very important in terms of your practical also. Then 37th, okay, and yeah, and 41 imaging USG. So these are some of the chapters which you should do after you are done with your notes from any platform. So you have to do your notes from any platform, then you have to read those chapters which I just told you from the Datta textbook. And after that, if you have a lot of time and if you are done with your surgery, medicine, and peds, you can mark those topics which are recurrently coming in your exams. Like in DU, we have Sarvesh Goel. So those topics are like repeated every year. So you can mark those topics in Datta, and if you have time and if you want to, you can read those topics from Datta as well, just to make it more clearer. And if you are not okay with it, or if you don't have time, it's okay. Notes are very much okay with it. Matlab, they can cater to all those questions that come in your exams, right? So here we are done with theory. Theory would be done in this only. Then practical. Practical may so in practical, I'll stick to my pattern, which I was given in my practicals. So we have Obs long case, we have Gynae case, and we have instrument, drugs, and a rest of the viva like USG, HSG, and a rest of the table vivas. So Gynae ke liye I'm presenting you one page. You can take a screenshot of that. Those are the topics that would be coming in your Gynae case cards, right? Okay.
Sonali, can you also name the chapters? The numbers you were sharing with us, can you also name participants are requesting for the...
Acha, okay, I should name them. Okay, right. All right, I'll name them. Then first of all, I'll name it only.
Thank you.
Okay. Okay, so chapters are physiological changes during pregnancy, endocrinology in relation to reproduction, diagnosis of pregnancy, the fetus in utero, fetal skull and maternal pelvis, normal labor, then okay, then operative obstetrics, and then imaging and obstetrics, right? Okay, 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 all right. Then okay, I'll share mine now. Okay, is my screen sharing?
Yes, we can see.
Okay. Okay, is it visible?
Yes.
Okay, right. So yeah, so this is Obs Gynae. Yeah. Okay, so these are some of the gynae cases, and I think sari case cards isi mein the. Every single thing is covered here, so you can take a screenshot of this. And these are the only topics. Actually, these are also the most important topics in terms of your theory exam as well. Okay, you take a screenshot of this. Okay, I guess we are done. So if I name them, it's imperforate hymen candidiasis, and a fibroid polyp, Bartholin cyst, H mole, and ectopic pregnancy, ruptured. You should know the difference between ruptured, ectopic, and because the management differs in both. Cancer cervix, right? Okay. Okay, so for the practicals, I'll suggest that don't be hesitant at all to present your cases during rounds. I assume that you would also getting a chance to present one by one, like your roll number wise. So present it nicely, and also attend all the discussions, because during the discussion, the question that are being asked by the teachers, by your professors, those are actually the most important questions, and they would be asked to you also if you get that case. And there are very selective cases in ops, like you will get FGR हो सकता है, diabetes, hypertension में everything, preeclampsia, gestational, chronic, है ना, and also polyhydramnios, multiple abortions in first trimester or second trimester. You should be knowing the causes for that. Then or multiple pregnancy, if you have those cases in your ward during your exam. So these are some topics that you would be getting in your ops cases, and actually those cases would being presented throughout the year. So attend your cases, present cases, and yeah, clear your doubts as in then, right? So you would be good with ops practical, then gynae practical ke liye I told you all the topics. Then for the instruments, we have Manju book of clinical hota hai ek book. There are a lot of instruments are given, or else you would be having your own PDF for your university. You can follow that. And drugs ke liye also you would be having your own university PDFs. Right. So that's all, I guess, for the ops gynae. If I forgot anything, you can ask your doubts, I guess.
Yes. So now would be a good time to ask your doubts related to the topics. And I think the most commonly asked question that I found when I was going through your responses was managing ENT and OPTHA in final year. So do any of our speakers have any opinions on how to manage ENT and OPTHA? I feel really bad that they have to study both in final year.
True.
I would have died if I had to do this.
That's really exhausting. ENT ophtha, I assume that you must have done your ENT ophtha notes in your third year itself, because it's not a good idea to keep it for your final year, because already you have a lot on your plate. So if you have done your ENT and ophtha, stick to your notes. That's it. Because ENT and ophtha, it's very minor subject, and if you compare it with the rest of your topics. So if you're done with your notes, stick to your notes. You don't have time to go through the book. Although Dingra is a very good book for ENT. And ophtha ke liye to I won't recommend only go through any books. Notes are more than enough. So I guess just stick to your notes, because you don't have much time, rest speakers can say.
I think for ENT and OPTHA practicals, it's very easy because ENT practical is usually always CSOM and OPTHA practical is usually always cataract. So maybe before the exam, just head to your wards once, take one or two cases max, and the other cases are usually very straightforward. Like I remember I had a deviated nasal septum. I think I also had a nasal polyp, but it was very easy. They also asked very, very basic questions. So just focus on cataract and CSOM for practicals. And Dhingra has a nice section on practicals at the back. That is the only practical source that I refer to besides notes that I made during practicals, during posting, sorry. For ophtha, there is a very nice practical ophthalmology book which comes with AK Khurana. And the good part is that it has a lot of differentials. So when you describe cataract, you call it painless progressive loss of vision. So your examiner will always ask about differentials of painless progressive loss of vision, painful progressive loss of vision, that kind of stuff. So those differentials are given very nicely in Quran, and you also have information on instruments, procedures. So you could cover those two books for your practicals. So it's very easy to do. And theory, the I usually don't read from notes, but I did like the Marrow notes for ENT. I thought they were pretty good, and they had a lot more information than even Dhingra to some extent, because Dhingra was not my favorite book at all. For Oftha, I found a little challenging theory-wise. So, I mean, I pushed myself to revise all the university questions. I read AK Khurana for Oftha. It was difficult, but I could do it. Like, so it took me around 2 days to revise Oftha, like all the PYQs from the textbook. So I think once you are done with your your syllabus at least once, just read ENT Oftha once, revise it once before you go back to final year. The key is always revision. So just try to squeeze in some time for the important topics.
Disha, yeah, actually, can you just see if there's any Obs Gynae questions for me?
Okay. Any Obs Gynae questions? Let's address those first. Acha, you told about important topics for Obs Gynae, important chapters. Can you say something similar for Gynae as well?
Right, for Gynae, whichever I said you to take a screenshot of that, I think those are the most important things to revise in Gynae. Apart from that, we have the cancer staging for like endometrial, for the uterus. They are very important. Those staging should be revised multiple times, and see if there is any updated or revised version before your like exams. And also the ovary cancer. So those are the most important thing which I said about the gynae case cards. Yeah.
Okay, I don't see any other Obs Gynae questions. If there is something, don't worry, we can answer. You
Yeah,
should go back to
sure.
your board.
Okay, thank you so much, guys. Okay, bye.
I am assuming Shaw only.
Sorry?
Which textbook for Gynac? I would recommend Shaw.
Yeah, sure. That's a very good book. I would recommend that too. True. Okay, so guys, I have to leave then. Okay, rest the speakers can do. I know. Okay, chalo, bye. Good night.
Thank you.
Thank you so much.
Okay, so I will start taking questions from the top. Sudhanshu and Hari
Just
can chime in.
just a point to like I wanted to add for ENT Optal. Like I feel like in our college, students are having their postings of ENT and Optal also. I think that's the best time to complete that if they want it, if they're not following the schedule. So that will give them a schedule also. And I think that keeps you kind of into that zone that where you can easily complete it also. Like it's of, I guess,
Even in my college, we have repeat postings for ENT and OPTHA for final year. So yes, again, excellent opportunity to revise if you have those repeat postings. Hari, do you have any insights on handling ENT and OPTHA?
As already said by previous speakers, make a crisp notes and revise just 3 to 2 days before the exam. this is the maths you can do, because you should rely on your previous memories. Because, already you should be master subject. This just right now is to for exam will be the good idea. Don't try to read in between medicine, surgery, and all. That is not a good idea. So make a grist notes and use it just before the examination.
Also, interestingly, so in ophtha, you can also try to correlate the two. For example, in ophtha, diabetic retinopathy, hypertensive retinopathy, they're all very, very important topics, and they're also very relevant for medicine. So if you could just
Yeah.
connect the two. If you're diabetes, while you're reading diabetes for medicine, revise diabetic retinopathy in ophtha. When you're reading oral cavity malignancies in surgery, revise that for ENT as well. So if you try to connect the two subjects, it might make your lives a lot easier. Because I remember having to go back
Yes.
to ophtha when I read diabetic retinopathy.
They've asked the question stages of diabetic retinopathy in my send up examination of medicine. So yeah, this is
Yeah,
actually good if you take in a good manner.
yeah, I had to read hypertensive retinopathy also. So yeah, this could definitely help you.
Yeah. Yes.
Uh, then we have, should notes for coaching and university exams be different? Nirmal
Not
says that he has made
necessarily.
notes for offline PG coaching, but he does not think that they will suffice for university. I don't think it really matters. I think if as long as you have covered all your previous year questions, like the ones that are most likely to come, the ones that have come for like many, many years, it does not matter where you read them from, but just make sure the headings that Hari told us about, etiopathogenesis, clinical features, how will you diagnose, how will you manage, and complications. As long as you have some idea of those subheadings and you're able to fit in your information in those subheadings, you'll be good. So just take a moment, look at your questions, see, do I know all these 5 points about this particular topic? And if you can, I think you should just move on to the next question. Do we agree?
Yeah, definitely.
Yes.
Uh, there was one question, which book to follow? Like I had followed Archit Bulur for theory as well as practical. So I really gained a lot of, like, it was easy for me to write in the exams also, like in the especially in the university exams and Viva also.
Yes. Yeah, actually, it will be given whatever the order which I told. Ethiopian is like that only. Nachit Bowler will be given in a nice manner. As I said already before, I will send the list. If you're able to answer those 6 questions, then you can read from any book, whichever you like. It's not like even no single book is good for medicine. So you can read from lot of resources and compile in a PDF or whatever manner which you like and use it just before the exam. So make a PDF of all compilation and use it before the examination. So MA this PDF like that.
Yeah, I personally think Archit Balur is great for both theory and practicals. Just don't say that you have read Archit Balur. Like if somebody asks, I don't know, say you read it from Harrison or you read it from Hutchison or the MacLeod's, but don't say that you read Balur. But I distinctly remember I spent 7 days, like I read medicine only in final year. I used to go for clinics and everything, but formally I read medicine only in final year, that too in the last 4 months. So I first sat for 2 months with Harrison. I read all the university PYQs from Harrison. And then when it came to revising, I read Bulur, the theory book, cover to cover. I read it once. Then the next time I read it, I read only PYQs, and then I revised another time and I read only PYQs. And that book was honestly a savior for me because it covers everything that you need to know about a particular topic, and it covers everything in a very presentable manner. So if you have read all of that, you will always be able to write something, and it will help in your vivas as well. Arjit Bulur practical manual has some errors, like some very glaring errors. For example, the edition that I had called the normal shape of the abdomen scaphoid. And if you were to say that to a professor, they will be really angry. So you have to be very careful of those mistakes. The way they have marked the fissures of the lung are also incorrect, I think, based on my memory of anatomy. So you just have to keep your eye out for those mistakes. But wherever they have given differentials, wherever they have given like the names of techniques, names of signs, they're pretty good. And examiners will often ask you those questions, but the problem is you don't find those answers in Hutchison or even MacLeod. So you have no option but to read Ballour to answer those questions. So yes, if I had to pick
In,
one for both theory and practical, I would go for Ballour.
Insider guide is also best for practical for medicine. They will give good DDs for every questions. All possible questions asked by prof they will be given. So whichever is good you can follow it.
Insider's guide is Ballour only, no?
Yeah.
Yeah, okay, fine. Okay, yeah.
We're talking about the
That is
same
the
thing.
same.
Ah.
Yeah.
So if you're short of time and you want to cover medicine, I would say go for Ballour. And just don't look here and there, don't look at other sources. Just pick one book and finish it off. Okay. Repeat the chapters to be done from Bailey in surgery. Okay. The units that you're supposed to do are endocrine and breast. You're supposed to do abdominal, genitourinary completely. You are also supposed to do arterial and venous diseases, shock, hemorrhage and transfusion, wound healing and tissue repair. I think that's all you were supposed to do. Yes, I think that's all you were supposed to do. Okay. No, I don't think ENT and OPTHA are being integrated with any subject. I think we have separate exams because my juniors have separate exams. Almost about to complete syllabus. Please suggest good methods of revision. So, Danshu, you want to answer?
Like I would say, for revising, it is if you know the things, you can just have a bit of active recall with yourself because that way it really integrates into your memory and just try to have a quick glance of it and just keep it a note of the paper, like what all things like you find difficult in and what all questions you do the wrong in the MCQs or like whenever you are there presenting case where you are stuck. If you keep writing it in a piece of papers, you will know your difficult topics and that way you know what you have to revise. Though you have to do the whole thing, but you know where to more emphasis on. I think this is which has helped me.
For me, I always read the important chapters over and over. Like even so for example, the important chapters that Sonali told us about in Obs Gynae, I probably read those at least 5 times because they were so volatile, like remembering all the diameters, it was very difficult. So there is no option but to keep revising, have it all summarized and keep revising over and over. Also, if you have posting notes often, when you go to your postings, your residents tell you what all is important. So you end up having a compilation of everything that you're supposed to revise right before an exam. So I read my posting notes even for theory exams. So that's how well I had designed those notes, incorporating all the little tidbits of information, the centimeters and the inches and, all the things that we're supposed to know. So yeah, you just have to make it easier for yourself to rapidly go through large chunks of information by the end. And honestly, it becomes easier. So the first time I read Ballour, it took me around 10 to 12 days. The next time I read it, it took me 8 days. And then the third time I read it, it took me 5. It gets easier. You become faster as you grow familiar with your text. If some okay, so Nirmal is asking if final year exams are in March, how to study according to that. I would say that you drop everything and just start focus. But no, drop everything in like January onwards and just start reading your previous year questions. Take November and December to read things that you've not read even once before. That's how I did it. So I started reading medicine in October. I took all of October, November, December to read medicine from Harrison. And then January onwards, I started revising other things like surgery, Obs Gynae, Peds, and Ballour. So that's the way I did it. If anybody else has any insights, please feel free.
Yeah, I think you have covered it well.
Then, books for surgery. Do you have, in my college, people often read Manipal, and there is one more book. I can't remember.
SRB,
No, no.
SRB,
Besides SRB,
uh,
there is one more.
uh, SRB, Bailey Love, and yeah, there was one more. I
That
don't
was my
know.
favorite. I'm trying to find it on my iPad. Once I find it, I will let you know. But I did not like Manipal. I mean, I would prefer SRB over Manipal because Manipal has very wrong information. At least the PDF that I had.
Yeah, regarding that, yeah, SRB is the only thing with Manipal is good that it is bit concise. I haven't read it, but I have seen it. It is concise and uh, like given in flowcharts and tables. Though my SRB also has it, but SRB is a bit extensive at places. Though many of my friends they preferred SRB only.
Mm. So somebody asked general SRB Manipal systemic. I think general surgery you should read from Bailey, like at least the important things. Because general surgery is given pretty nicely in Bailey. Baki, I will find that book, which I really liked. In the meanwhile, Sudhanshu, can you address the other queries? Hari also.
Yeah, I'm seeing. I think Hari has got disconnected.
Acha.
So,
It's okay,
yeah,
we'll answer. No problem.
Manipal, is it enough for surgery? See, yeah, if you read it, if you retain it, remember it, it is enough. But again, the thing is that whatever source for me, like I did not spend much time with the books. I had it mainly the Marrow lectures and notes, so I covered it. And for whatever the previous topics I had by in the university, I only referred to those from the SRB. So it was my strategy. But if you have time, definitely you should give time, as told by the Jay also. Like you should read those important chapters from the Bailey and Love because they will develop your concept. So yeah.
The book I was talking about is Gunjan Desai.
Okay.
Yeah, I found SRB way too long and it was too overwhelming. I did not feel the need to read that much. And Manipal I knew was full of wrong information, so I just read Gunjan Desai. It's a little outdated, but it does cover topics pretty well. How to manage
Next,
preparation with uni exams? I'm not the right person to answer
it's a
this.
difficult question for me also. I guess Aditya Boss would be better here if he's there to answer this question. I guess if he is there. Uh, but yeah, like I guess there is not much difference. The only difference is that like you have to have a habit of solving MCQs and a habit of revising the things. That's what I in internship I follow, and many of my friends also do the same for that. And from my seniors, I've also heard it. So just because MCQs are going to help you in the prof examinations also, so it will help you revise also, and yeah, that will help you in NEET PG preparation only. Otherwise, I think regarding the syllabus or something, there is not much difference. Only for INICET, there can be few important topics. There was one like Nikita ma'am on her app, you can get the past year topics for free. You can download them from free.
Are there any good practical sources on YouTube for medicine practical case discussions and examinations? So one thing I used to do was whenever I wanted to see a video of a particular sign or something or a reflex, I would just go through like 10, 20 videos to see how different people were doing it. I would read it, and I would also obviously read it from Bolur. I would just watch 10, 20 videos so I understand, I remember what the reflex looks like, And then I would read the technique from Balloon, because very often, the technique they describe, like the way you're supposed to do it, just sometimes does not happen. Like, so for example, if I have to elicit knee jerk in somebody who's really obese and cannot sit, I will not be able to lift their legs to demonstrate. But I should know the technique word to word, and I should still know what it looks like if I were to do it on a thinner patient. Yeah, so just see as many videos. There is one channel, I will just go through YouTube and I will let you know the name of the channel. Is there any other channel that you use, Sudhanshu,
For
for medicine?
medicine, for CNS, I refer to Dr. Polaris. Like I found its video quite good, and for medicine, I refer to the whenever I had to present cases, I often saw the cases of White Army, and even those pillar. Cyanosis, all these things, pallor, these things I referred from the White Army because they had given it well and they had given it the differentials as well. Though it is given in blue there, so I found White Army a good source for that. And like uh, from the practical pediatrics, also you can see some of the examinations well. And regarding the basic physiological things which are there there is one channel that is Waqas Khan. So that I found he has some good videos.
Yeah, there is also this channel run by somebody who is, I think, at JNMC Vardha.
I guess you're talking about Waqas Khan only, or I don't
Nahi,
know.
nahi.
Nee,
He
nee.
has a very nice
Yeah,
YouTube channel, and he uploads these little snippets of clinical signs. I'll have to
okay.
find that channel.
You can see it later and share.
By Dr. Saurya Acharya. So the channel is called Clinical Snippets by Dr. Saurya Acharya. I'll just write it in the chat. He has demonstrated some really cool signs. So, for example, I remember I wanted to visualize the signs of aortic, the peripheral signs of aortic regurgitation. So he had a very nice compilation of Winky sign and some other signs which I had not seen in my wards because it's not a common case to see. So he has some nice videos. Okay. All good. So if there are no other questions, shall we end the webinar?
Yeah, I can also see there are no questions.
Okay. Is Marrow enough?
No, answer is no. Because definitely for university, you need to have that past 10 years things, and yeah, that you have to do it. And after that also, like if you really want to have distinction, you should cover whatever the competencies are there. Like, but if you like cover the past any important topics, you will be in the like at least in the top 20s. You are there.
Also, sometimes professors make it a point to ask things that are not in Marrow, just to prove a point. So I would, yes, as Sudhanshu said, you should be very thorough with the previous year questions, and you should be very, very thorough with your practical examination. Because Marrow will not be able to teach you practical examination. That is something that you will learn as you go take cases yourself, as you auscultate, per case and palpate different things, and as you read your practical manuals. So Marrow is good for some things. Like I remember, so for example, gestational diabetes mellitus. It is given terribly in Datta, and I had to read Marrow for it. Otherwise, I did not read Marrow or any other coaching notes for my final year. But it is given very well in Marrow. So I think obstetrics is very nice. It's good to read surgery, all of surgery at least once, but you will need some more in-depth knowledge for your, at least for the important questions to do well. How to study PSM? PSM is not really a final year subject, but I read Parks, I read previous year questions, and I also read Vivekja. Yes, those are the things that I did. for PSM.
You can also refer to last year webinar that is there on the YouTube.
Yes, yes,
Yeah.
we only had taken that webinar. I
Yeah.
have just gone
Yeah,
through
there is one.
I think Gunjan Desai is pretty sufficient to answer. Uh, to get a distinction, I mean, it's very difficult to get a distinction in surgery. I mean, at MAMC, nobody got a distinction in surgery. The only distinctions that were there were in pediatrics, and one in pediatrics and one in Obs Gynae. No other distinctions. So I don't think professors are very inclined on handing out distinctions in these subjects.
Same for my college as well. I hardly remember. I guess only in one or two subjects also we had distinctions. Otherwise, it's very difficult actually.
Yeah, I know medicine and
Yeah,
surgery is impossible. Obs Gynae sometimes still, pediatrics also. Um, yeah, Gunjan Desai will definitely help you pass. I mean, that's for sure. It has enough to help you pass. Also, distinction is given at 80 in clinical subjects, at least in Delhi University. Ophthalmology, how did you remember terminology? Again, it's just revision. You just have to keep revising. Marrow initially and last 2 months books. I would go the other way. I would read books first and then consolidate whatever I read with Marrow, and then just alternate between the two.
but I feel like for me, it was actually I had seen the lectures first and books later. Like I would definitely not recommend last 2 months, but like if what my strategy was, like I used to read the lectures and then at least I got a gist of it, like what are the important things, and then I went through the book. Like, but it works for some. But what Disha said, like that is also if you are good enough with remembering the concepts and understanding it, you should definitely do that way.
Yeah, I guess this one is something that one just has to figure out what they're comfortable with. But don't just start something new in the last 2 months. I mean, at
Very
least
true.
leave a margin of 4 or 5 months before you start something new. Okay, then I guess we're done. Thank you so much for attending. And the recording of this webinar will be shared on YouTube. So if you have any lingering questions or you missed any part of the webinar, you can always go back and check. And I will ask Hari for the notes that he had made, and I will share them with you guys. Thank you.
Thank you, everyone.